Hi, Dr. Pedro here from the TMJ Jaw Pain Center. If you have TMD, we know that one of the major issues with TMD is related to muscle activity. Quite often, I see a lot of patients who have clenching or grinding or a combination of the two. And so these muscles really get really active. And when it's clenching, most people are not aware that they're doing it, particularly if it's nighttime and you're sleeping. As you can see, these are major muscles, and they bring the jaw up, and they really can bring a lot of force. And if you're doing this every night, you're never really getting a break, and these muscles can really get cramped, sore, and put a lot of pressure on the TMJ joint. The TMJ joint sits right here in front of your ear canal. Patients come in with soreness in this area, or in the temporalis muscle, or in the masseter muscle. And that's because these back teeth send signals when they contact to activate those muscles. You may have come to my office and I recommended an NTI appliance. And what that does, that NTI appliance, is it is a custom-made appliance that only covers the front 6 to 8 teeth. So these teeth here would be covered, or we can even do it on the bottom. And what happens is, this is a very sophisticated system. We call it the stomatic-gnathic system or the masticatory system. And all these nerves are inputs that send sensory input or messages or signals on how hard we need to chew. Have you ever eaten eggs and maybe had an eggshell in there? You know immediately that eggshell's there, because that's how sensitive our teeth are because of the nerves and the neural inputs that go on here. But when we're clenching and grinding, we're getting a whole new set of signals that tell these muscles, when the back teeth meet, that, hey, we need to clench, we need to grind for no good reason. So we want to take those inputs away. So what the NTI appliance does is it has a little ramp that fits in front of these teeth and only allows these bottom 2 teeth to touch. So when you bite down when you're sleeping, you're sleeping, you're not even thinking, that the NTI appliance only contacts here in the front, and it prevents the back teeth from hitting. And because the back teeth are not hitting now when you're sleeping, these nerves are not giving any signals for these back teeth to clench or grind. So that's why the NTI appliance is so effective, is because it prevents the back teeth from clenching and grinding. And the other thing I like about the NTI appliance is when these muscles are able to relax the whole night through, and they're not active and they're not, in play, it'll take away some of those headaches that you might get that are caused by the tension that's caused by the clenching, right? So it's really a very cool device. I don't recommend you try to make one at home yourself. What we do is, when you come in, looks a little bit like this. This is just the tip, and we scan digitally your teeth. We scan the upper and the lower, and then we also scan your bite, okay? And then that shows up as a computer file that we send to our special lab that only makes NTI appliances. So we have to make sure that it fits, and we have to make sure that when you wear the NTI appliance, that you can still move your jaw all around in every direction. And remember, you only want to wear the NTI appliance at night. It's possible to wear it more than that, but as your dentist, or if you see a dentist, you want to make sure that you follow their instructions. You don't want to wear it 24 hours, because then it could change your bite, and that would be a problem. Remember, NTI appliance, it's been around for 30, 40 years. I've had, during my whole career, I've had very good experience with patients who have TMJ. They wear this device as directed, especially if you clench, and it takes away all the biting pressure that's caused by the clenching. All right, so I recommend that you look into that. So good luck, and subscribe to the link below.